ketamine has become the generation-defining drug for young Brits. Use has risen 30% year on year, mainly driven by 16 to 24-year-olds. It's no longer an underground choice. This strange, powerful drug is as mainstream as Coke or E.
It's kind of become a staple of our generation, especially in the UK.
Ketamine. On the street, they call it Special K, Kit Kat, Vitamin K, even Jet. But this isn't candy, and it's not just a party thing. Today, we're pulling back the curtain on the world of ketamine, the highs, the dangers, and the medical breakthroughs you may not have heard about. I'm Dr. Yomi Adeyemi, board certified urgent care doc. Let's dive into the K-hole. Hey guys, really quick before we jump into the video, I just want to say that, believe it or not, more than 90% of you guys watching this video right now aren't subscribed. I want to continue bringing you guys high quality content here on the channel. And to do that, we need your support. I'm not sponsored by any big industry names, and everything we do here on this channel is supported by you guys. So if you subscribe now, my commitment to you is that me and my team will continue doing everything in our power to bring you guys the highest quality content. Thanks for listening. Let's get into it. First, let's talk about street names and street games. Special K is the club classic, usually snorted, sometimes injected, and sometimes slipped into drinks. Other names you'll hear out there: Kit Kat, K, Cat Valium, Jet, Super Acid. But whatever you call it, this isn't some safe recreational ride. At high doses, users talk about falling into a K-hole. That means intense dissociation, out of body, sometimes total paralysis. People report seeing colors, shapes, even feeling like they're dying. It's not a party for everyone. And on the street, you'll never know what you're getting. Fentanyl, other drugs, sometimes even fatal combos, all out there. Now, ketamine is more than just a street drug. These days, it's become a powerful clinical tool when used properly under medical supervision, rapid sedation and analgesia in the ER. Since the 1970s, ketamine has been used for battlefield and emergency anesthesia, especially where maintaining blood pressure and breathing matters most. In emergency rooms, low-dose IV ketamine can control pain and provide procedural sedation without shutting down your ability to breathe. A recent study found both low and moderate doses can cut pain by over 2 points on a 10-point scale in less than an hour. Pain management and opioid-sparing benefits. Ketamine, either alone or with opioids, can lower pain after surgery, cut down on the need for narcotics, and reduce nausea. It's even used for chronic pain states like neuropathic pain and complex regional pain syndrome. I've even seen it used for people with sickle cell related pain crises. Now, in the last 2 decades, we've learned that single IV ketamine infusion can lift severe depression within hours, and those effects can last up to a week. Now we have an FDA-approved nasal spray version called esketamine for patients who haven't responded to traditional antidepressants. It's always administered in a clinic with strict monitoring though, because the side effects can be serious. Now, early research shows ketamine may quickly ease PTSD symptoms, and it's even used in rare, severe seizures that don't respond to other treatments. There are some caveats here. Even in the hospital, side effects are real. Dissociation, dizziness, high blood pressure, and outside medical settings, there's zero oversight, no safety net, and a real risk for misuse, overdose, or addiction. Now, ketamine is a medical powerhouse, used safely for pain, anesthesia, and depression, but its safety and effectiveness hinge on dosage, monitoring, and clinical oversight. It demands respect, not recklessness. We're only beginning to tap its potential, but every dose needs a doctor's guidance. Now, we've talked about the promise of this drug when used in a clinical setting with the guidance of medical professionals, but the reality of this drug can't be understood unless we shift our attention back to the streets. Let's talk about what ketamine can really do to the body when it's abused. and why recreational use is never harmless. Overdose, death, and polydrug nightmares. In the UK, ketamine-related deaths have skyrocketed. In the US, ketamine-involved deaths almost always happen alongside other dangerous drugs, especially fentanyl, meth, or cocaine. Even celebrities aren't immune. Matthew Perry's cause of death? Acute effects of ketamine. A chronic ketamine misuse can destroy your bladder, causing pain, urgency, incontinence, even bleeding. Some users need surgery or a permanent catheter just to survive. In extreme cases, people have lost nearly all bladder function entirely, urinating dozens of times a day and even passing pieces of their own bladder lining. Long-term abuse literally shrinks the brain. MRI scans show loss in areas responsible for memory, emotion, and clear thinking. That means memory loss, confusion, and big drops in decision-making ability, even after quitting. Higher doses can send users into the famous K-hole, which involves paralysis, hallucinations, and loss of time and place. And some people never fully recover from all this. The psychiatric fallout, paranoia, hallucinations, symptoms like schizophrenia can last long after the drug is gone. And let me tell you, I live in Los Angeles. We see the fallout from this drug all over the streets, and it's not pretty. Even the pros can get it wrong. In 2019, Colorado paramedics accidentally gave Elijah McClain a massive overdose of ketamine, resulting in his death. Some EMS and police teams are still using ketamine in ways that can put patients at risk. Now, ketamine is not a harmless party drug. It destroys bladders, erases memories, and mixed with other drugs or used recklessly, can kill. Every dose is a gamble with your life, your mind, and your future if used improperly. Now, if you know someone who is struggling with this drug, don't wait. Get real medical help, because this is a tragedy that is absolutely preventable. So, is ketamine a miracle drug or a ticking time bomb? Well, the truth is, it's both. In the hands of a trained doctor, it can save lives and change lives. But out in the wild, the risks are real and growing. If you're struggling or you know someone who is, don't do it alone. Reach out, get help, ask real questions. And if you want more real talk from a doctor who's seen both sides, subscribe and join this movement. I'm Dr. Yomi Adeyemi. Stay dynamic. Peace.